The infective stage of Entamoeba histolytica for humans is the tetranucleate cyst. Flask-shaped ulcer in the colonic mucosa is pathognomonic for infection by which protozoan? Entamoeba histolytica. Motile pear-shaped flagellate that lacks a cystic stage and causes foul-smelling vaginal discharge. Trichomonas vaginalis. Falling leaf corkscrew motility in wet mount is characteristic of which intestinal protozoan? Giardia lamblia. Doc for giardiasis in pregnancy, first trimester, when nitroimidazoles are contraindicated. Paramomycin. Kala-azar is diagnosed in peripheral blood by visualizing bodies inside macrophages. Leishman-Donovan anesthetic bodies. RK39 immunochromatographic test detects antibodies against which parasite antigen? Leishmania-Donovani kinesin-related protein. Host Kala-azar dermal leishmaniasis typically appears after successful therapy with which drug? Sodium stibogluconate. The only malarial parasite that forms Schiffner dots and enlarges the infected RBC, Plasmodium vivax. Artemisinin-based combination therapy, ACT, recommended by NVB-DCP India for uncomplicated P. falciparum is artesunate plus sulfadoxine pyrimethamine. Relapse in P. vivax malaria is prevented by primaquine 0.25 mg per kilogram daily for 14 days. G6PD testing is mandatory before administering primaquine to avoid severe hemolytic anemia. In P. falciparum, sexual forms gametocytes develop in man over about 100 days, 10 to 12 days. Thick blood smear is more sensitive than thin smear because it concentrates parasites by below lysing red blood cells. Blackwater fever in falciparum malaria represents intravascular hemolysis precipitated mainly by the drug quinine. Babesia infection is transmitted by the bite of Ixodes scacularis tick and shows Maltese cross forms inside lank erythrocytes. Trypanosoma brucei gambiens causes West African sleeping sickness and is transmitted by animal, fly, tsetse, glossina. Chagas disease megacolon is caused by infection with Trypanosoma cruzi. Xenodiagnosis is useful in chronic infection with which hemoflagellate? Trypanosoma cruzi. Congenital toxoplasmosis triad, chorioretinitis, hydrocephalus, and intracranial calcifications. Doc for acute toxoplasmosis in pregnancy after first trimester, spiramycin. Acanthamoeba keratitis in contact lens users is treated topically with polyhexamethylene, biguanide, chlorhexidine combination. Naegleria fowleri causes fulminant primary amoebic meningoencephalitis that gains entry via something, cribriform plate during nasal irrigation/swimming. Enterobius vermicularis eggs are best demonstrated by Tate method. Cellophane, Scotch. Perianal pruritus in children at night suggests infection with pinworm, Enterobius vermicularis. Mass drug administration with albendazole 400 mg periodically targets soil-transmitted helminth most prevalent in India, Ascaris lumbricoides. Ascaris pneumonia with eosinophilia during larval migration is called ... syndrome. Leffler. Strongyloides stercoralis causes autoinfection by larvae penetrating the perianal skin, filariform. Hyperinfection with strongyloides is common in patients receiving long-term ... therapy, corticosteroid, immunosuppression. Ground itch at entry site is typical of infection with hookworm species, Ankylostoma duodenale, or Necator americanus. Godfrey egg counts using Cato Cat's thick sneer report hookworm eggs per gram of feces. Gram, actually 41.7 milligrams template extrapolated to eggs per gram. Cutaneous larva migrans is due to skin penetration by larvae of dog-cat hookworm. Lymphatic filariasis in India is caused mainly by Wuchereria bancrofti, showing nocturnal periodicity with peak microfilaremia around blank midnight, 10 p.m. to 2 a.m. Doc for microfilaremia clearance in Bancroftian filariasis is DEC at milligrams per kilogram for 12 days, 6 milligrams per kilogram day. Wolbachia endosymbionts in filarial worms are eliminated by adjunctive therapy with antibiotic, doxycycline. Onchocerca volvulus infection leads to rarer blindness due to microfilariae invading the cornea. Doc for onchocerciasis mass treatment. Ivermectin 150 micrograms per kilogram annually biannually. Loa microfilariae showed diurnal periodicity and are visualized in peripheral blood around noon, 10 a.m. to 2 p.m. Doc for Loa infection when microfilarial count is less than 2,000 per microliter. DEC, diethylcarbamazine. Speak, rat tapeworm that completes its life cycle in a single host, man, and shows autoinfection, Hymenalepis nana. The scolex of Taenia solium has suckers and a double row of hooks. 4. Neurocysticercosis in India is most commonly due to ingestion of Taenia solium, eggs, via fecal-oral route. Doc for solitary parenchymal neurocysticercosis lesion. Albendazole 15 mg per kilogram per day for 7 to 14 days, plus steroids. Echinococcus granulosus hydatid cyst fluid shows sand consisting of innumerable, protoscoluses. Pear, puncture aspiration injection reaspiration is contraindicated if hydatid cyst is located in brain, spine, superficially risk of rupture. Best answer, brain. Schistosoma hematobium eggs have a terminal spine and are demonstrated best in a sample. Midday urine, terminal smear. Katayama fever is an acute serum sickness-like illness due to massive antigen release in ? Infection. Schistosomiasis, particularly S. japonicum. DOC for all human schistosomiasis at 40 mg per kilogram single dose, praziquantel. Chinese liver fluke that predisposes to cholangiocarcinoma, Clenorchis sinensis. Ingesting raw, undercooked crab crayfish transmits lung fluke, Paragonomus westermani. Eggs of Fasciola hepatica are large, operculated, and require snail species as first. Intermediate. Doc for fasciolasis resistant to praziquantel, triclobendazole. Toxicara canis visceral larva migrans shows marked peripheral blood, eosinophilia. Anopheles mosquito eggs are boat-shaped and have lateral floats. Culisine mosquitoes breed preferentially in dominant water habitats, polluted, stagnant. Nisarhynchus, Anopheles stephensi larva lacks blank plate on the posterior end. Siphon or breathing tube, they lie parallel. Aedes aegypti can be distinguished by white bands on legs and a lyre-shaped design on the thorax. Measure of filarial transmission is nan-biting rate multiplied by infection rate in mosquitoes, called index. Vectorial capacity, or entomological inoculation rate. Head lice infestation is treated topically with 1% permethrin. Resistance warrants oral drug, ivermectin. Single dose, 200 micrograms per kilogram. Scabies mite, Sarcoptes scabiei, completes its life cycle entirely on a one-name host, human, obligate. Classic nocturnal itching in scabies is due to hypersensitivity to mite, feces, secretions. Crusted Norwegian scabies in immunosuppressed patients is treated with combination of topical permethrin and oral, then, ivermectin. Tumbu fly, Cordylobia anthropophaga, causes furuncular endemic in continent, Africa. Obligatory lival stage of Dermatophobia hominis, human botfly penetrates skin via phoretic deposition by mosquitoes, vector-borne. Tick paralysis is caused by neurotoxin secreted in saliva of female blank ticks. Ixodes dermacenter, any correct. Blackwater fever prophylaxis emphasizes avoiding intermittent therapy. Quinine/chloroquine in non-immune individuals. WHO recommends single-dose albendazole plus ivermectin annually to eliminate filariasis. Lymphatic, W. Bancrofty, B. Malai. Eggs of Taenia saginata differ from T. solium by absence of hooks in scolex, but egg morphology identical. Key difference is scolex hooks absent. Dipylidium caninum infection in children is acquired accidentally by ingesting infected dog flea, Tinocephalides. Microscopy of stool using formalin ether concentration is essential for detection of protozoan, Giardia, Entamoeba. Modified acid-fast staining 1% H2SO4 detects oocysts of coccidian parasite, Cryptosporidium parvum. DOC for cryptosporidiosis in immunocompetent patient, nitazoxanide. Cyclospora cayetanensis oocysts become infective after days of sporulation in environment. 1 to 2 weeks, about 7 to 13 days. Enteric coccidian parasite Isospora belli responds dramatically to therapy with trimethoprim sulfamethoxazole. Merthiolate iodine formaldehyde MIF is a preservative medium for samples. Stool parasitology. String test, enterotest, is used to retrieve trophozoites from duodenum. Giardia lamblia. Filariasis elimination target set by WHO uses threshold microfilaria prevalence from some percent to stop MDA, 1%. Vector for Bancroftian filariasis in rural South India is primarily mosquito, Culex quincofasciatus. Small liver fluke Metagonomus yokogoi infection acquired by eating raw fish, freshwater. DOC for Hymenalepis nana infection. Praziquantel 25 mg per kilogram, single dose. Trichinella spiralis encysted larvae are found chiefly in wig muscle, skeletal, striated. DOC for trichinellosis systemic phase, albendazole plus steroids. Microfilariae and blood smear of Brucei malai are sheathed and have terminal nuclei, 2 distinct nuclei at tail tip. WHO-approved rapid test for lymphatic filariasis uses immunochromatography to detect antigen. Circulating filarial antigen, CFA, of W. Bancrofty. Eosinophil count exceeding 0 cells per microliter strongly suggests tissue helminth infection. 1,500. Praziquantel causes tetanic contraction of flukes by altering Ca+ permeability of membrane, tegument, muscle. Larvicurans, rapidly moving serpiginous rash, is diagnostic of hyperinfection by Strongyloides stercoralis. Japanese encephalitis virus reservoir hosts are pigs and birds, Eridid, herons, egrets. Dermatobia hominis eggs hatch when triggered by X of host skin, body warmth, CO2. Intermittent shedding necessitates examination of obvious stool samples for ova detection, 3 on consecutive days. DOC for invasive amoebiasis liver abscess is metronidazole followed by luminal agent diloxanide furoate. Characteristic Chinese lantern appearance of eggs belongs to which cestode? Diphyllobothrium latum. Megaloblastic anemia in D. latem infection results from depletion of vitamin B12. DOC for diphyllobothriasis. Praziquantel 25 mg kilogram, single dose. Zoonotic tapeworm that causes cystic echinococcosis in sheep rearing areas, Echinococcus granulosus. Hydatid cyst surgery must be preceded and followed by albendazole for at least weeks each. 4 weeks. Blackfly simulium breeding habitat is fast-flowing, streams, rivers. DOC for dracunculiasis guinea worm is rich, no drug, slow extraction and wound care, prevention by water filtration. Gnathostoma spinagerum infection acquired by eating raw fish causes migrating subcutaneous larva migrans, nodules. Spirorid nematode in human conjunctival sac forming worm granuloma is Thalasia callipida.